Why do you think there is such a gap in funding for mental health compared to other major conditions like cancer, diabetes, or heart disease?
It's sobering when you look at the statistics globally. Mental health, and in the US, this is the case as well. We
Mhm.
spend only about 2% of our total health budgets on mental health, even though depression is right up there. In fact, a little higher than back pain for total disability money. In other words, the amount of disability days lost, things like that for depression is even higher than back pain. It's number one in this country now. Yet we only spend about 2% of our budget on this. And one of the reasons we think that is that there's a stigma attached to mental health. All right. We don't really, when we talk about mental health, we don't really talk about it as a medical condition or in terms of biology. Right. And part of that is because you can't see it. If you're, think of all the specialties, the medical specialties that exist. If I am a radiologist, I can see a tumor growing on your lung. If I'm a cardiologist, I can measure that your heart is an AFib. If I'm a cancer specialist, I can see the cancer growing in your blood. You can visualize all this. In mental health, it's really the only specialty where you're treating a patient based on something you cannot see. All right. And so it really becomes difficult then to convince organizations and groups and even companies to invest in mental health because it's so abstract. And until we get to that point where we truly see it for what it is, for biology, for a medical condition, it's probably going to stay that way. And also the stigma that's attached to it.